Hey guys, today I'm going to show you all about doing a well child check in MDHQ. There are features in here that make it a lot easier, than, in my opinion, than in other EMRs, but you have to know where to find them. So I just wanted to show you how to use all this. So a lot of EMRs nowadays do have a photo option. I highly recommend this, especially if there's more than one kid in the family. It keeps you from mixing them up if you have all their tabs open at the same time. I'm going to kind of go step by step through here. So under their personal information, oftentimes I'll have different phone numbers. I'll put like the home phone number, mom's cell, dad's cell, and so then I'll just put a note down here like mobile is mom, other is dad, just so that I know which phone number, which parent I'm going to be getting on the phone. And actually I should have shown you here too. You can also choose Plan A, Plan B. So in my office, Plan A is a monthly membership and Plan B is Medicaid. You can't do this yet. You'll see here, oh, I can't say that bills are paid by another patient, and I'll show you why in just a minute. You have to first create a relationship. And there's one of the things I love. Everyone's relationships are right here. So Babs Bunny here is actually the child of John Doe. There we go. And the niece, there we are, nephew niece of John Doe. There we go. And so that way I don't get confused when I'm looking at a kiddo who this kid belongs to, because a lot of my families will have different last names. Kids will have different last names from parents and from each other and so forth. And so I'll just have the whole list right here of who everyone's related to. You can also put coworkers, or you can put other relationship. So it's really helpful to me to have that because I can kind of pay attention to who's related to whom. It's also easy. Let's say mom says, well, mom's not in this one, dad. Let's say dad, while he's here, says, oh, by the way, I have this weird rash. I can just click on him and he'll open his own tab, and now I can start a note for him as well. So that also makes it easy to go between charts. Once the charts are connected, now you can go in under billing information, and you can say John Doe is responsible for this one's payments. Edit patient, and that will save that. And now let me show you over here. It says subscription none. If you actually pull it up, it says subscribe to John Doe's plan. So Babs Bunny is not paying for a subscription herself, but she's subscribed through her father. So that's handy there. Plus, when I enter payments, let's say I'm going to charge, I don't know, I do a TSH on a 12-month-old baby. Let's say she has Down syndrome. We're going to do a TSH. I can click right here. This charge should be paid for by John Doe. And then he'll have it charged to his account. And you'll see she still owes 0. But there's this -3 charge that says apply to John Doe's account. So pretty handy. Babs Bunny used to be an adult. That's why we have these here. I just changed her to a kid a few minutes ago. Normally you would not see colonoscopy, DEXA, and fecal occult blood testing on a kid. But I just changed her age. And also she obviously would not be taking that dose of Tylenol as a baby. So let me just take that off there. There we go. So let's say that Babs Bunny comes in. She's here for her appointment. She's here with her dad today. So we're going to start a new note. I always label them well child check, and then which one, 12 months. It's an office visit. Then I do note, well child check, and poof, oops, I didn't go down the line. There we go. There's the gist of my note. Now for her, I don't have her social history, family history, and so forth entered in. And it's giving me her vitals from last time, which are obviously not correct. So we'll take those out because she's here this time. And then usually what I do with my families before they come, I use the ASQ here for my screenings, and so I send it to them in the portal. So what I do is I go under My Links, Browse My Documents. Here's ASQ 12 months. So I copy that to her chart. Yes. So that's waiting there. So mom or dad can then get this out of the chart and print it. So they usually come in with the ASQ already done. If there's a family who I can see right here has not been using the portal, then I can just go ahead and email it to them. And so I'll say Babs Bunny's ASQ And then I'll just send it directly to Bab's family, and then they just get an email. And you may didn't hear in a minute that I got that email because that's my email address. So then they can print it, fill it out, bring it in already done, which is really handy. So anyhow, Babs is here for her well check today, and they brought in the ASQ. So I'm just going to use the my pre-written template for well child. I'm spelling terribly here. Subjective well child check, general. So she's here today for well child check. No concerns, no illness. Let's change this. Apparently this is a single dad. Dad doing well. For most people, myself included, mom is the one here 99% of the time, so I check in with her. The rare occasion a dad comes in or both come in, I can go ahead and put them right there. Ages and stages completed, reviewed together today without concerns. Let's say that there was, Dad does note that Babs loves jumping off the dining room table and has questions about that. So I can put other notes in there too. This is my standard well child check review of systems, so I have it right there in front of me. And I'll say, have you noticed any fevers or chills, recent illnesses? Have there been any rashes or skin lesions? Any breathing issues? I always kind of say, I'm sure you'd tell me if she turned blue at any point. And they're like, no, she never turned blue. Any problems with her bowels or bladder? Any feeding difficulties? And then we usually end up talking about that for a few minutes. Any sleep concerns? Usually end up talking about that for a few minutes. Let's say that they're having some issues with sleep, so I recommend the No Cry Sleep solution. So there it is in the recommendations. Let's say, I'm trying to think, Dad had a really rocky childhood and he wants a book about that. We can just go ahead and pop that in there too because he doesn't want to pass this on to his daughter. So I can just pop whatever in there for the parents. Then we come down here under objective. Oh, I haven't put in her, sorry, I don't have a kid in front of me. I don't remember what we're doing. So let's say I weighed and measured her today. So I just click on weight here. So today's weight was 25 pounds, or 23 pounds rather. And let's turn this to ounces. And 5 ounces. Let's say that this was done in the past. Let's say that she brought in her old records. I want to get them all in here. I can actually choose any date that I want. So you can go back and put in old vitals too if you want to put the complete growth chart. But today I'm going to do just today's. Let's see, her height today is 30 inches. And you can see still that calendar there we could choose from. Her head circumference is 46 centimeters. I made these numbers up, so I kind of based them off of a real kid's growth chart. There we go, 46 centimeters. So you can then just pop this little pop-out button here, and there's the growth charts. So you can see here's the weights, here's the heights. If you want to see a big one, you just click on it, and there's the whole thing there. This prints really easily for mom. If you have the Pinterest button, you can save it to Pinterest too. But you can see the different percentiles just like on any other EMR. This shaded area I didn't have on my old EMR. At first it bugged me because this line is like horizontal, or not horizontal, but like diagonal across there. But I actually have come to completely rely on it because I love not hunting for which line I'm supposed to be following. It shades where the growth line is. So now that I'm used to it, I can't imagine life without it. So here's Bab's growth chart. So you can see she's just above the 75th percentile for weight. She's about 75th percentile for height. I did a great job making this up. And 75th percentile for head. Excellent. Okay, I bought this and stole from another baby. Let's say you wanted to see the exact amount something was. So, what exactly was the head circumference on January 7th? That was 38 centimeters. So you can go in there. You can also, let's say that you made a huge error. So I have been known on occasion to enter something really funky. So let's say I put 72 pounds instead of 17 pounds. You can just hit this delete, and it'll confirm that you want to delete it, and then we'll go ahead and delete it. The other thing that patients sometimes get a kick out of when the kids get a little bit older is I'll put it on the full growth chart up to 21. Obviously, at this age, it doesn't quite show it so much, but you can be like, look, when you're 20, they might be about this tall. So that's always a fun thing to do for people if you're bored and have nothing else to do. So there's growth charts. It doesn't graph blood pressure for babies because I'm not checking the blood pressure, but if you did, you could have a blood pressure chart there as well. So that one's fun for adults to show them their blood pressure is getting better and better. So I have a chart part here so I can enter in her vitals. So I have just measurements. Then for exam, I have all these well child check options. She's kind of an infant. I'll probably change this to toddler here. I'll say growth reviewed and all at 75%. I always read through real quick to make sure that everything that it says I did. I'll add in things that are different, like maybe I'm not checking her fontanelle today. How old is she? I forgot. 12 months. You know. So whatever you may or may not be doing. Then we have discussion. So I have well child check. Let's say I use a little one here. Let's say this family is non-vax. I've been talking about it every time, so I just have continued discussion of safety and benefits of vaccines. Let's say I want to give them a handout. So I can go here. I have my, here, if you choose not to vaccinate your children, so I'll put that into their portal so they have that information. And they're coming back at 18 months, so I'll go ahead and put the 18-month ASQ in there while I'm doing handouts. Patient instructions. Here it's going to be very tailored. Usually I type the instructions actually as I'm seeing the patient. So usually at this point, by the time I get to the end of the note, the instructions are actually already filled in because as I talk, let's say I'm discussing with mom, you don't feel like you have to put your baby on a strict schedule. It's going to be whatever schedule works for your family. There's, I don't care if your friend puts their baby to bed at 5:30 in the evening. You don't have to put your baby to bed at 5:30 in the evening. Maybe your baby prefers to sleep at 7. Then put your baby to bed at 7. So I might say, each family has their, and usually I'll say it as I'm typing it so they know what I'm writing. Each family has their own pattern. It's important for babies to have a routine, but choosing the routine that works for you is the best. Whatever. So as I'm talking, I'll put those things in there. I can put in the handout. I didn't do this when I was in there, but for 12-month well check, just kind of the expected kind of stuff for the age. And then when I'm all done, let's say this is a member, so I don't have to charge them anything, but let's say that I was going to charge them for, actually, let's put that TSH in here. So we're going to do, so there's a healthy child, routine child health exam with abnormal findings, and then let's go ahead and give her Down syndrome here. So I have a reason to check a TSH, and then we're going to schedule her TSH here. Her reason for that is Down syndrome. Build a physician. Go ahead and print an order, and then down here I could go ahead and put in that TSH. All in the same note as I'm working. So it makes it really nice and smooth. Oops, I'm not adding another, just adding one. And then let's say this note was done, I just save and sign. In this case, I'm not given the option of sending a summary because they haven't used the portal. Or it hasn't been enabled. Typically, I would have enabled the portal, I would have sent them an invitation. If they hadn't used it yet, so if this was yellow or orange color, kind of orange color instead of red, I would go ahead and teach them how to use it while they were here. And that way I could go ahead and send them an appointment summary with all this information. So that is the gist of doing a well child check in MDHQ. I may have forgotten something because I didn't actually have a kid in front of me, but I think this is most of it. If you have any questions, let me know.